Welcome, friends, to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Hello.
And we're going to start a new series talking about hip pain. I didn't realize there were so many causes of hip pain. So tell us what we're going to talk about today.
You wouldn't think just, one joint, it's not a little joint, but it's a big joint, but you wouldn't think one joint could have so many things that cause pain in it, and the pain in your hip can be extremely debilitating. So today, our first topic is actually going to be femoral acetabular impingements.
I'm glad you didn't ask me to say that.
We are here talking about hip pain, and specifically about femoral acetabular impingements. Now, I need to give you a little bit of anatomy of the hip, okay? It's a ball and socket joint, which means we got a socket from the pelvis, which is the acetabular fossa right here, and the ball of the femur sits right in it, okay? And this socket is extended by a labrum that helps make it more stable, okay? So many times we can get an impingement in that joint, in that labrum. Many times the labrum will get pinched, and or the other soft tissue. We got lots of muscles and ligaments and tendons, all that stuff around this joint. So any of that soft tissue can easily get impinged and cause you a lot of pain. Now that pain normally is going to be felt more in the groin area, and it can even go down, kind of the side of your leg and even into your buttocks. It can cause a lot of pain and be very debilitating. So if you have pain that's similar to that, we're going to show you a few stretches that you can do at home and a couple of exercises to maybe help improve your mobility and decrease your pain. So today we have Johnny Pye. He's one of our marketers here, and he's going to be our demonstrator today. So Johnny, go ahead and sit down. What he's going to demonstrate first is what's called a piriformis stretch. You're going to cross one leg over the opposite knee, and you're going to pull that knee up toward your opposite shoulder, and you're going to hold that for 30 seconds, and then you're going to push that knee down and away, and you're going to hold that for 30 seconds and do that 3 times each direction. Now remember, with stretches, we just want a gentle stretch, not pain. All right, and then the next is going to be the hamstring stretch. All right, so you're going to put one leg out, the leg you're stretching out, and then you're going to reach towards that with your hand. All right, trying to keep your back relatively in a straight, neutral position. You should feel some stretch in the hamstring back here, okay? The hamstring, it goes over the hip joint and the knee joint, so it's important that you keep it stretched out. You're going to hold it 30 seconds and do it 3 times, okay? So those are 2 stretches that may help give you some relief. And now I'm going to show you a few strengthening exercises. Now guys, I want you to go to a surface that is stable, that will not move on you, to help make sure you don't have a fall while you're doing this, okay? So Johnny's going to hold on here and demonstrate what we call a hip 3-way, okay? So first we're going to do hip flexion, and you're going to start off doing that maybe 10 times. And then hip abduction, which is out to the side, about 10 times. And then kick that leg straight back. Make sure you stay up nice and straight, that you're not bending forward whenever you're going back, because then you're not really going to be strengthening those hip extensors, okay? So all of these exercises, you're going to start like 1 set of 10, all right? If that's easy, then you can go up to 2 sets of 10, 3 sets of 10, or 15, and then you can maybe start adding some ankle weights. So those are some good stretches, good strengthening exercises for you guys to start doing at home. So I hope that will help. If not, come see us at Fyzical. We'll do a more thorough evaluation and set a individualized plan of care to help you overcome your impairments. Thank you. We'll see you next week.